I think Shockwave is invaluable in that it is giving us a new treatment strategy for deep wall calcification, allowing us to treat arteries that even rotablation couldn't deal with. Historically, we weren't able to get good expansion in these really heavily calcified vessels. I think also it has become very much an easier instrument to adopt, an easier tool to adopt. And with that, you're getting much more recognition that we need to modify calcium, we need to image calcium, we need to understand where Shockwave fits in. And even when Shockwave isn't perfect, isn't giving us the best answers or the best results, we're learning from that. And I think the great thing that I found with intervention is that we're still continuing to learn. And Shockwave has really exploded calcium and helped us look at it in a very different way, and it's given us brilliant outcomes for patients where we didn't have a strategy beforehand. And it's accessible. It's accessible for people who would always shy away from rotablation and would avoid it because of the complexities. When Shockwave first came on, and there's the same with all technologies, there's always oh my goodness, is this going to cost more or is it cheaper? The reality is, though, we all know that failure in a cath lab is bad, and bad outcomes are underexpanded stents. And however, we'd like to measure that, we see these patients where we have underdeployed stents coming back into our same cath lab quickly. It's not within 5-10 years. It's normally within a year. And they come back with either an ACS or recurrent angina. And it's because we failed to treat them properly in the first place. That's what is expensive. And Shockwave helps us prevent that failure. It goes on and on. There are multiple cases where we look at how Shockwave works. And, there's always a question mark with a new technology. Is it going to work in this subset? Is it going to work in this one? And yes, we have algorithms to help us. But I think we always feel pleasantly surprised on how effective it is. It's such a clever tool, it's a clever idea, and it's disruptive, not only for the whole calcium world, it disrupts in the artery, but it is disrupting our approach to patients and how we're dealing with them. And it's fantastic.